Every day was just endless problems. My entire life, every moment of it, was ruled by my condition.
Pelvic floor disorder is anything that affects the female pelvis, and it's usually in terms of function. Patients will come in and they will complain that their bladder is falling, or they'll complain that they are leaking urine if they cough, laugh, or sneeze, or that they are unable to control bowel function and things that are associated with that.
Surgery to correct pelvic floor dysfunction, which involves rectal prolapse and fecal incontinence, is not required. Dietary changes, such as a high-fiber diet or hydration, alleviates the symptoms. In addition, biofeedback, which is retraining and strengthening the pelvic floor muscles, can improve symptoms.
I had a 2.5-year-old daughter, and we were pregnant with a second child who was due in December. That morning went to the hospital, delivered a healthy baby boy. And about 7 to 9 days later, I remember something, feeling uncomfortable, thinking perhaps it was a blood clot, and noticing that my cervix was actually protruding through the opening of my vagina, and it was alarming. And I went immediately to see my OB, and he said that this is something that happens often. Women live this way, and that often it would retract over time.
You know, I probably experienced problems about 8 years ago, and I just had this thing sort of coming out of my body, and I went to a gynecologist, and all he said was, "Oh yeah, everybody has that. That's your cervix."
Pelvic floor disorders run the entire spectrum of age. Younger patients will oftentimes have these problems when they're associated with trauma from childbirth, but not always. Older patients will suffer problems like prolapse of the vagina, or what they commonly would refer to as a drop bladder, also associated with all of the bladder function issues that younger patients will get. One of the major problems that women with pelvic floor disorders experience is that many of them have had operations that have failed in the past, or they were the inadequate procedures, or they were wrong operations. And those patients, there are very few places for them to turn for help.
So prior to Dr. Garley, I had had a severe prolapse. I had gone to an OB that I trusted. He had delivered my children, and I wanted to see if I could feel more comfortable. Ended up having a hysterectomy and having an anterior-posterior repair that had me in and out of the operating room 3 times. And I just knew something else, so even continuing, seeing that doctor after, I knew that something still wasn't correct, and I just decided I needed to see what else was going on. I knew something wasn't right. And I went and I found another OB who directed me straight to Dr. Alan Garley.
My vision for the Women's Center at South Nassau Community Hospital is to develop a center where women can have all of their care taken care of in one center.
Our ultimate goal is to give women a voice, where they don't feel ashamed to express their symptoms, where we can work together to come up with a custom-tailored treatment plan.
The goal and our vision at South Nassau is to create a place where everything can be done, including the most advanced imaging studies, which is something that South Nassau is really unique in having in all of Long Island and New York, in that we specialize in pelvic floor imaging, which helps us immensely in making diagnosis and in treatment.
Dr. Garley did a surgery, including a hysterectomy, and promised me no pain. Click, true. Promised me I'd be back in my real life, doing things I hadn't done in years within 3 to 4 weeks. Click, true. And really, I have to say thank you, Dr. Garley and South Nassau Hospital, for giving me back to me.